Hey, this episode was filmed during the COVID pandemic, so for the safety of our cast, everyone is seated 6 feet apart. Also, this series is for information and entertainment purposes only. It isn't intended to be a substitute for professional medical advice, diagnosis, or treatment, so don't delay or disregard professional medical advice based on the information provided. And, as always, if this is a medical emergency, dial 911.
Welcome to Going to Health.
For people, from people.
So this one time,
Oh, I'm gonna go get some tasty waves, bro.
extreme athletes, how does that tie into the military?
It's team training for them. It's taking one individual athlete
Right.
and now having them function as a unit seamlessly. A very different environment. But it was a huge correlation between racing at the professional level with sailing and building the teams as they build within the military. You know, I can't ask whether you brought the ladder or the axe. I can't be doing your job. I have to assume that when we're there and we need to cross, you're going to be there with the ladder, and you've done your job to bring your piece.
Right.
I need to be focusing on the team working together and trusting their back and trusting the person behind them. It's the same way on a high performance boat. You have to know that the person setting the sail or the jib is going to bring it around when you turn that corner. You can't be driving that part of the boat while you're driving this part. There's an important principle that gets back, and I'll use the sailing analogy because that's one of my passions and love. My wife and I both race boats.
Wow.
You have to get your head out of the boat. You can't be thinking in the boat. When the wind hits the sail or hits you, you need to be trained well enough and understand it well enough that will just be a response. And with the teams and the special teams, they need to function so seamlessly as a unit that their head is out here, seeing everything and taking in everything around them, maintaining that mental endurance and that focus. And if you want to talk about focus, try to focus with bullets flying around you, things blowing up, people getting shot at.
I can't
I mean, we went and simulated it. Fortunately, I did the medical end. I didn't have to get shot at. But try to maintain focus with that much distraction to full awareness of everything around you. Getting a chance to sail with some of the best sailors in the world and seeing how much farther out of the boat they are than the rest, or getting the chance to go out and participate in activities with the SEALs. It's an unbelievable experience.
So now I want to ask you about Ruby Rose. Can you tell us a little something?
Ruby Rose, the Batwoman, came to me after an injury she sustained while she was on set, and blew a couple of discs in her neck very badly and hit her spinal cord, and was really down to the point of having trouble walking.
Wow.
She came and we put artificial discs in her neck. You can type in Ruby Rose neck surgery on the internet. You can watch her surgery. She put the surgery on the internet. Actually, me looking through the scope, putting the disc in her neck. She put the surgery on there. 20 million something views the next week. But with what we've pushed Hollywood to, we're seeing really people functioning at elite athlete level. And many of the actresses and actors are doing much of their own work.
Haley, did you have a question for Dr. Bray?
I actually did. I was reflecting on the conversation that we were just talking about how when you're driving off-road and living in your car, you know, taking the hits from the rocks and different terrain, but really you have to be living out here. It really related to me and my experience of working in the operating room and building the team in the operating room and living in the future, right? So I wanted to kind of ask you a little bit about your practice.
I love it. I get to be here with an operating room nurse.
Well, I guess we'll leave.
We'll go we try to apply the same principles that you have with building a special forces team, with building an elite sailing team, with building to the OR, because that was one of the teams where you can't let things go wrong.
Yeah.
But you have to trust every person through the team. You can't afford things not to go where they're supposed to go.
Right.
Absolutely.
There's somebody asleep you're responsible for.
Absolutely, and
So
it's a different,
team building.
right?
But that same thing applies to any sport. Even if you're the driver, you still need your whole team to put the car together, do the course, do the tactics. If you're driving the boat, it's multiple people. You have to learn to work with those units.
What kind of surgical environment are you mostly operating in? Are you in the hospital? Are you in the surgery center?
I'm biased because I'm the one who created the field of high acuity, meaning complex, outpatient world. So we're putting a lot more attention. We run one nurse for one patient post-op. We have a great deal more equipment than you'd see. So we believe in very high acuity for that window of care, but that's allowing me to do everything I do as an outpatient. Spinal tumors, rods, screws, through the front, through the back, disc replacements, all as an outpatient.
So you don't operate at the hospital at all?
I don't anymore.
Wow. And for spine, that's incredible.
I guess your team, you all have each other's back, no pun intended.
No pun intended, we do, and you have to trust, train, and work together with them. And,
Wow.
and it's building, and it takes work to build it, but it's worth it.
It does. It's a different experience if it's your first
much
time
is.
operating with a team versus your 45th time operating with a team.
So Dr. Bray, changing gears, I hear you get back to the community. You have a foundation called the DISC Foundation. Could you elaborate a little more on what that's about?
The DISC Foundation has been running for years now. We do several different things. This year, obviously a very stressed year for everybody. I took all my wealthy patients that had contacts, and we did the logistics to bring in personal protective equipment, and through contacts and the Sands Corporation out of Vegas, they flew a plane over to China. We bought things in, picked them up, filled the plane, brought them back and handed them to the hospitals. The other one we run, I owe my career to the military. They trained me all those years, and I try to give back. We created a structure called Valor for Life. It's one word, valorforlife.org if you want to look it up.
Okay.
Right.
And I wish I could do it for everybody, but we take special forces of any branch,
Right.
and anything that we can do at DISC, we do for free for them for life. And we've been running $300,000, $400,000, $500,000 a year in free care. It's been great, and the amazing thing is we've gotten to know just a tremendous number of these guys who are great heroes, and it's been a great experience for us, and it's expanding. We hope to keep expanding it, loop in other centers around the country as a plan to be able to expand the network that's giving, and hopefully expand our donor network. So far I've had patients that have been very appreciative, and they support us.
They say the road to hell is paved with good intentions. We believe the road to health is paved with good information. Thank you for joining us on this quest to understand extreme sports injuries. We'll see you next time on The Road.